Hey everybody, it's your favorite doctor here, Dr. Tiffany Butler, and welcome to my channel. And in this video, I'm going to discuss, by request, cervical spinal stenosis. So this is a very short video, just as piggyback off and on the cervical dysfunction or neck pain. Alright, so what causes cervical spinal stenosis? Alright, so let's get my spine. Let's go over some of the anatomy. Alright, so this here, the purple part here, this is the cervical spine. The cervical spine has 7 vertebrae. Grab my pen. I'm dropping everything today. Alright, so cervical spine have 7 vertebrae. So 1, 2, 3, 4, 5, 6, 7. You have the intervertebral disc, which is in between the vertebral bodies, which is here. Alright, and you have the, if you see this part, this is the artery right here. You see that? That's the vertebral artery going through the transverse process. And these yellow things are the spinal nerves coming off of the spinal cord. The spinal cord is sort of an extension of the brain because it's made up of the same materials. Now, stenosis is a result of the narrowing of the space in between the joints. All right, so the space right here where the spinal nerves exit. Even though I'm talking about the cervical spine, let's go to an area where you can see a little bit better. Let's go to the thoracic spine. All right, so you see this, just for understanding, you see how the nerve exits right there through that hole? All right, so the same thing up top in the cervical region is nice and open. What happens is that space starts to narrow down, and largely due to spinal degeneration. All right. Now, as a result of degeneration, meaning there is change in the structure, so change in the bones and change in the disc. So the disc should be nice and spongy, should be nice spongy space in between each vertebra, okay? And as a result, that's what causes this to be open, right? It's because of the disc here. So as the disc, if it's not spongy, it starts to dehydrate, which we call degenerative disc disease. It starts to thin and flatten out, and that reduces the opening in the space. As a result, the body, in an effort to protect itself, will lay down more bone. As a result, you have degeneration. You start to have bone spurs or osteophysis there. You'll start to notice decreased range of motion within the segments that is affected by the degenerative disc disease or by the arthritis. As a result, the person will start to, there will be inflammation and swelling, and then they'll start to experience pain and discomfort. Now, cervical spinal stenosis is largely diagnosed based off x-rays, primarily plain film. And a lot of people don't know that they have it until they see an x-ray. All right. Some of the symptoms a person may experience is numbness and tingling going down the arm, or sharpness or stabbing pain, either local area or down the arm. They may also experience deep, dull pain or even pressure, as well as muscle stiffness, joint stiffness, muscle tightness, and spasm. All right. So the main thing with spinal stenosis is the main thing is the person will experience the symptom of pain going down the arm, so either in the shoulder, in the elbow, forearms, wrists, and hands. All right. Now, a way that a chiropractor can treat the cervical spinal stenosis is through spinal adjustments. So the goal of adjustments is to place your body in the best position so that it can heal naturally. When there is a force applied to your joints, especially from external force, such as using our hands as a chiropractor, the goal is to break up the scar tissue too, right? So once you break up the scar tissue, you're able to move around a little bit better. As you move better, it pumps fluid and edema out of the area. And as a result, those nerves feel less irritated, and you will perceive less pain. The spinal adjustment does not correct the spinal stenosis, all right, because that is due to degeneration, all right? There's degenerative changes not only in the bones, but also in the disc, all right? The disc is dehydrated. So some of the things you can do on your own is make sure you're drinking enough water, not doing anything that's sort of going to exacerbate or make that worse, all right? Make sure you're sleeping properly. So the best way to sleep is on your back. That's the first best position. The second best position is on your side. You don't want to sleep on your stomach if you are experiencing cervical pain or lower back pain, especially if you're experiencing cervical spinal stenosis. That's only going to make your symptoms worse. Another thing we do in the office, second to chiropractic adjustment, is using a cervical cervical decompression machine. And what it does, the decompression sort of pumps the disc. All right, so instead, let me show you the images. So the machine I have in the office is decompression. So the person typically either they lay on their back, okay, like this, or they may sit up, okay. Now with the decompression, what it does it pumps the disc, so it distracts up and then it pulls down. It distracts up, then it pulls down. It distracts up, and then it pulls down. All right, so it's pumping the disc. As it's pumping the disc and moving the joints, it's removing fluid out of the area. All right. Another way we can help it is with cervical traction. So with traction, it can also be done like this. A person is laying on their backs, and we may either put a block under the upper back area so the head can fall down. We may use a strap to help pull the head back, or we may have you doing it sitting up and put something over the head and sort of do like that to basically open up the joints. All right, all of those things, whatever provides you with relief is what we'll use. All right, so if it feels good to have the joints pulled or your head pulled up on, then that's what we're gonna do. If it hurts, then we obviously we won't do that. If you have any questions or comments, please feel free to put them down below. If you like the video, hit like. If you want to share it, feel free to share. If there's any health topics you would like for me to address, go ahead and let me know. All right, so some consequences of not getting help if you have cervical spinal stenosis, unfortunately, is something that gradually occurs, and because it's alongside with this degeneration, the person may experience symptoms of cervical spinal stenosis, but may have a normal spine, meaning they may not have any type of degenerative changes in the cervical spine region. As a result, the numbness and tingling you're experiencing is not due to the degeneration in the joints and the disc putting pressure on the nerve. It is because of inflammation. All right, so what you can do is get your regular spinal checkups. How often should you go? If you have never been to a chiropractor for a good spinal checkup, then I would suggest you go at least once a year to at least get things checked out. If you are experiencing any type of musculoskeletal pain and or discomfort, musculoskeletal pain would be muscle and joint pain, then go see your chiropractor. Why? Because this is what we do all day, every day. We treat not only neck and back pain, also treat shoulders, knees, hips, elbows, ankles, feet, and all that good stuff. All right, so that's what you can do, is to be proactive in your health. You know, preventive care is health care. So catching something before it becomes worse is the key. All right, what I've seen is just people just don't want to do anything. They don't want to do any changes. They rather either eat medicine or just acknowledge that something that exists does not exist, which does not help you at all, because you can't wish it away. All right, so that's all I have for you today. Remember to take care of yourself. A healthy mind and healthy body creates a healthy life. Stay healthy.